Hi everyone, Aaron Brooks with Perfect Postures, and today I wanted to talk about actually a client that we saw yesterday, and a lot of people will be able to relate to this. We're in the Boston area, so we're starting to get the warmer weather. People are becoming a lot more active. People are more running, playing more tennis, starting to get on the golf course. This particular person started playing tennis, and he came in and he was complaining of a hamstring pull, pretty enough where it was affecting his function. So he was getting on the outside of his hamstring, and then it was actually going down into the lateral portion of his knee. Now, typically when people have that pain on the outside of the knee, we always think of potentially IT band syndrome, or maybe there's some tight tissue in the IT and the lateral quad, and possibly even be with the hamstring there. But here's the interesting thing, and this is something that I wanted to share with you because it's something that in traditional healthcare people don't really look at this. And what that was the weakness in his left hip flexor. And so what I did was I had him sit on the bench. I had him roll his pelvis forward, so he was creating an arch in his low back, and he was sitting really tall. And then I just did a quick manual just to see how strong he was with lifting one leg off the floor versus the other leg. On his left leg, he was much weaker than his right leg. So this is where it gets kind of tricky. I'm trying to keep this as simple as possible. But when the hip flexor kind of turns off, kind of shuts down, it actually allows for more extension of the knee on that particular side. So again, his was on the left side, so his left hip flexor was just kind of turned off, really is what it was. And then that was causing his knee to extend. So I looked at his gait pattern as well, and I could actually see that. He was getting almost like an excessive extension at his knee. So he came in, he was having hamstring pain. I had him do some activation techniques of his psoas, and when we got done, he actually had a significant decrease in pain. So, most people think a hamstring issue, well, we got to stretch it, we got to stretch it, we got to stretch it. However, I didn't do any stretching with him at all, but I did do activation techniques of his hip flexor muscle, and his hamstring felt better. So, I just want to really share that with you because it's something that typically when people have pain areas, like hamstring or your groin, people always think, oh, we got to stretch it, you got to stretch it. With rotator cuff, we have to, we got to strengthen it. There's always going to be a greater factor, meaning looking at it from a biomechanical standpoint, there's something happening that's causing that particular issue. So what we're going to do is we're going to show you an exercise, a quick activation technique tool, what I used for this gentleman, with the corrective exercise. And so we'll give it a shot. If you are having a chronic hamstring pull, it may be because of the hip flexor, it may not be because of the hamstring. So stay tuned. If you have questions, please ask me. We get a lot of great questions on our site, or people actually shoot me personal emails as well. But stay tuned, and we'll see you next week. Thank you.